like cancer, diabetes, and osteoporosis at the very beginning. The very beginning, and when they are easier to treat. Screening tests can spot illnesses even before symptoms appear. The screening test depends on age, on the family history, the personal health history, and other risk factors. The importance of health screening. Health screening helps detect potential life-threatening problems, just like Dr. Nelly says she had some members of family that were diagnosed of cancer, but it was rather late. But if they had been screened, it should have been discovered and been looked after, and death will be averted. It minimizes unclear ambiguity and confusing results. So during screening, you already have an idea that this is what my screening says, and which push you further to have a test and confirm really whether the problem is there or not. It helps to identify abnormality before symptoms appear. I want to talk about myself. Way back, we had the medical retreat in MFM. I'm a worker in the church. And we had the retreat about 14 years ago. And I was the head of the medical team for that same screening. And at that spot, I was diagnosed to have glaucoma. And I was saying, I reject it, just like any other person would say. And I had to press further to go and check that, is it really true or not? And until then, I was confirmed positive and I had to take my treatment, which will cause some people to have blindness without knowing, because it might not have symptoms. Helps to identify people who are at risk. It serves as a preventive measure. It helps to identify early warning signs. Sometimes you have people, they just come at work and they say they have stroke because they have never checked their blood pressure. Then nobody knows really that they have hypertension until a stroke is developed. It also increases the chance of management and cure. When cancers are discovered early, they are cured, they are managed well, and the person lives a better life. And it promotes a long and better life. It helps to avoid painful symptoms, leaving the risk of complication even when the disease is present, and increases lifespan and improves health. Factors affecting health screening for women. Lack of awareness. A number of women are not aware that they need to screen themselves, and as such, they come up with diseases. Absence of symptoms. They will say, yes, I don't have anything, and why do you have to go and test? Screening is important. It's just to check the set of people within the community who might have a disease. Social stigma. For example, when we started checking for HIV those days, once you are positive, they start saying that it is HIV positive and all that, and people don't want to have such. Lack of adequate healthcare facilities. For example, when we do screening now, where do we go if we are positive? We have to probably go to tertiary institution, and it's packed filled with people already diagnosed. Cultural constraints and belief. Most times when we come because of our belief, and as Christian, as a Christian organization, we talked about as you're so prosperous, so you should prosper in health, according to 10 John 2. But you find out that people will say, I reject it. Anytime a Christian is being told that, yes, something is wrong with you, the person will say, I reject you. But by the time you know it, while the person is in denial, the sickness or disease is progressing. Financial constraint. When people are diagnosed, our health facilities, they are not free. Embarrassment due to nudity. I have had calls to examine some women, maybe do breast examination, and they find that they are not free with me because I have to expose a part of their body and to embarrass. Yes, even ladies, young ones like you don't like to be checked. Yes. Embarrassment due to nudity. Economic factor. Illiteracy and lack of routine health screening free program. So we're bringing this opportunity to you, and I want to appreciate Dr. Nelly once again. And others try, please. The incidence of morbidity and mortality is gradually increasing due to lack of regular health screening. For women, the major contributor to include breast cancer, cervical cancer, ovarian cancer, and osteoporosis. And this presentation of mine this morning is going to be limited to breast and cervical cancer. Epidemiology of breast cancer. Most common type of cancer worldwide is the breast cancer. And it's a major cause of public health concern. You can see I reference WHO 2021. It's the fifth leading cause of death among women. And it is noted that 685,000 deaths worldwide occur as a result of breast cancer. 2.26 million recorded in 2020 by WHO, which is reported in 2021. Historically, it's been low in Nigeria. But in recent time, it is discovered because of urbanization, people coming from the village and the kind of lifestyle we adopt. Some women, the way the Lord has created them, they are not pleased, and they are trying to put silicone, they are trying to put string things on their body just because they want to impress somebody. But now, it's increasing as a result of urbanization and lifestyle changes. About 23% of all cancer cases, breast cancer, constitute about 23% of all cancer cases in Nigeria. And it accounts for about 18% of deaths of women due from cancer is breast cancer. Early detection remains the primary way to prevent the development of life-threatening breast cancer. Breast cancer that are detected when smaller and non-palpable are more treatable and thus associated with more favorable prognosis. Regular self-breast examination for any lump or swelling and the clinical breast examination like would be done by a medical practitioner or a healthcare worker. It can be a doctor, it can be a nurse. And the imaging studies used in breast cancer screening include ultrasound scan, we have what is called mammogram, I'm going to talk more on mammogram, and then what we call MRI, magnetic resonance imaging. Mammogram is the most common screening test for breast cancer. And MRI can be considered for women with high risk and with family history of cancer. Between the ages of 20 to 30, some experts have recommended that healthcare providers perform breast examination as part of a regular examination check in the hospital. There might be need for frequent screening in case of extra risk that has been discovered by any health practitioner. Mammogram, there are low-dose X-ray that can detect lump before they are felt by the patient or the client or whoever the person is. Though results don't completely rule out cancer. Some experts recommend that starting from age of 40, women should have a mammogram every year. Recommendations vary between 1 and 2 years for mammogram from age of 50 and 70 years. Healthcare providers may recommend more frequent screening if somebody is found at risk. Mammogram is an X-ray examination of the breast. It is used to detect and diagnose breast diseases in women who either have breast problems such as lump, nipple discharge, as well as for women who have nipple breast complaints. That's the procedure. You can see the radiologist or radiographer trying to position the woman for a mammogram. And as the woman, she has her breast pressed against that simple metal, and she's going to have the radiation exposed to her to have the test done. Types of mammograms. Screening mammograms. X-ray of the breast is used to detect breast changes in women who have no signs and symptoms of breast cancer. Diagnostic mammograms. It is used to diagnose of user breast changes such as lump, such as pain, nipple thickening or discharge, or change in breast size or shape. Then what is breast self-examination? self-breast examination, and we're going to look at this. Breast self-examination is a technique which allows individuals, so it means that all the women here, including myself, we can do a self-examination on ourselves. And then for any physical, you're going to see through a mirror for physical changes in the appearance and the size of your breast, and be able to report as early as possible. It is often used as an early detection of breast cancer. Steps in breast examination. Self-breast examination, we have inspection, just having a visual, just looking at it. You can stand looking, and that is standing before a mirror. Palpation is another one. You can stand lying position, palpation standing or sitting. And that is a picture of somebody looking, standing before a mirror and looks at both breasts and the nipples. So you can adopt three positions. You can stand with your hands by your side, you can stand with your hands on the hip, and you can also stand with your hands on your head. And the second way to look at it is by touching. You have raised your left arm, raise your left arm, you use the part of your second hand, the third and fourth finger right hand to examine your breast, left breast, and you do to the other side as well. Once in circle, the motion and the way you examine, you do it in a circular way, making smaller circles around your nipple. And once in way starting from outside towards the nipple side. And the third one, while you're lying down, you lie on your back, your left arm under your head, and under the pillow, your left shoulder. Examine your left breast with your right hand, as described before. And repeat the right side, and this position flattens the breast and makes it easier for examination. You're going to look at the lymph nodes. There's possible things that you will see if there's any challenge. It's like their inflammatory signs. You will notice it under your armpit. Place your left hand on your waist. With your right hand, try to find a large lymph node in the left underarm area and around your left collarbone, and repeat the same to the right side. And a large lymph node feels just like a corn kernel or a bean. You see it small there, like a corn kernel or bean. Pap smear screening is also known as pap test or Papa Nicholas test. This is a procedure in which a small brush is used to gently remove cells from the surface of the cervix and the area around it so that they can be checked under microscope for cervical cancer cells that may lead to cells that can lead to cancer. A speculum is introduced into the vagina to widen, to give it a better look so that one can see, and then take a brush and insert it into the vagina to collect the cells from the cervix. And we're going to see a demonstration. The pap smear is currently considered the gold standard in cervical cancer screening. It is a cytological test in which squamous cells are scraped from the transformation zone for cytological examination by the pathologist. Recommended to have it done every 3 years for women aged 21 to 29, and for every 5 years for women aged 30 to 65. Women over 65 can discontinue screening if the initial screening were negative. Results of an adequate pap smear may be reported as negative. It can be positive and it can be termed borderline. The positive observe, and when it is positive, you're going to observe, repeat in 3 months, and then you have a low squamous intraepithelial lesion. Then, and that, according to the statement, you will say scene 1. Then when it is positive, you treat, you repeat, and then the higher squamous intraepithelial cell will be treated. Borderline, treat and repeat in 6 months. And then we talk about ASCOS inflammatory changes, HPV changes, and negative 3 years repeats to normal. An abnormal pap smear may be reported as ASCOS, LSIL, or HSIL according to Bethesda system. The normal repeat, when it is normal, you have a repeat after 3 years. But the ASCOS, which is atypical squamous cell of undetermined significance. The inflammatory and HPV changes. There's inflammatory and HPV changes. What we do at that stage is to treat and repeat another test after 6 months until we get a normal test. Then what about the low squamous intraepithelial lesion? Low-grade squamous intraepithelial lesion. You repeat again every 6 months until it regresses to normal. Then high squamous intraepithelial lesion, do colposcopy and the biopsy for histology confirmation before treatment goes on. That's a pap test. Like I was talking about, inserting a speculum through the vagina, the woman placed in a tracheotomy position, and that's the third section of that examination you are seeing on the slide. What are the indications for pap smear? Malignant tumors, lesions, pre-malignant lesions, irregular vaginal bleeding or discharge, then at the follow-up check for cervical cell abnormalities. The procedure, just as you have seen in that first section, is a painless procedure that takes just few minutes to complete. The patient is requested to lie in what we call on the back and the legs flexed, and that we call a dichotomy position to examine with the knee bent, the heels are rested on the stirrup for support, and the doctor or the healthcare who may be a nurse who is trained a personnel next insert and puts a tool called speculum, precisely called Cosco speculum, into the patient's vagina. And the speculum serves to hold the vaginal walls to expose it better. And the doctor or the healthcare provider then obtain the sample of the sex of the cervix with the use of a brush, a small brush. And according to American College of Obstetrics and Gynecology screening guidelines, just as I have discussed, that is a table that when a woman is less than 21 might not need screening. But for a woman between the age of 21 to 29, pap smear alone once every 3 years. And then for a woman that is age 30 to 65, pap smear and HPV co-testing every 5 years, or pap smear alone every 3 years. And the comment is when the screening can be done by HPV testing alone is not recommended. Age 65 and older, no screening after adequate negative prior screening test. So if somebody is at like 65 now and has not had any positive test before, there might not be need to have a check again. Women who have had hysterectomy, their uterus has been removed, they might not have, no screening is necessary. This applies to women without cervix and with a history of high-grade cancer or cancer in the past 20 years. Then women vaccinated against human papilloma virus, same as vaccinated. Well, we're looking at the epidemiology of cervical